What are the parameters of IVF success? An important question to ask. But we see a lot of IVF laboratories celebrating or cake cutting ceremony taking place in the waiting lounges just because your beta HCG is positive. That means your simple pregnancy test is positive. I think it's too premature. Because having beta HCG positive just means your implantation has taken place. It doesn't even mean that you have a clinical pregnancy. A clinical pregnancy is one when you do a sonography and you can see a pregnancy. A clinical pregnancy is good when you see a sonography, a pregnancy, and a heartbeat activity. An ongoing pregnancy is the one, a pregnancy which is continuing beyond 18 weeks of pregnancy. And a live birth rate is the one where the baby is delivered after 28 weeks or after 7 months of gestation, which is live. So not every beta HCG goes into a live birth rate. So do not prematurely celebrate a beta HCG that could be just a commercial attitude of the company. So the success of parameter is actually the live birth rate. And that live birth rate not only depends upon the embryo quality, it depends upon how you have carried through the pregnancy. Certain pregnancies of IVF demand a very close attention, especially pregnancy in obese women, pregnancies in women beyond 35 years of age, especially beyond 40 years of age, pregnancy with women having hypertension and diabetes already. All these things demand a very special attention, or twin pregnancies for that matter. And all the pregnancies conceived out of egg donation programs, all they require a very special attention and close monitoring to have a successful childbirth. For us, a success of IVF, we look at it as cumulative pregnancy rate. So cumulative live birth rate. What I mean by that is we do one IVF cycle with a good amount of stimulation, form multiple embryos and keep sequentially transferring the embryos. And you look at the pregnancies obtained at the end of transferring all the embryos. For all you know, you could have completed families with 2 babies at the end of transferring all the embryos over less 4 years. Or you could fail with first transfer, may succeed with the other. So you're going on one IVF cycle, because you had 2 chances of embryo transfer, your success will be high. So at this juncture, we are looking at cumulative live birth rate per IVF cycle at our center. Thank you so much.